Okay, perfect. We got it. Okay, Nikole, thank you for taking the time out of your day. I really appreciate it. Truly, I do. So quick question for you. When you decided you want to be a nurse and what motivated you to become that?
I don't really know. I've always wanted to be a nurse. From the time I was young, I knew I was going to be a nurse. I don't really know why. I just knew that I was going to do it. I also have two other sisters that are nurses too.
Fantastic.
I also have two other sisters that are nurses.
Well, rare is it that a person knows what they want to be when they're small. You know, usually they think about it and they got to worry about it and everything else. So the fact that you knew about it and you became it.
Yeah, I really don't know. I just knew I was always going to be a nurse.
That's fantastic. And you've been a good shepherd for how many years?
23.
Fantastic.
Mm-hmm.
That says a lot about the place because they have that kind of continuity for sure.
Yeah, I mean, we have one of the managers that's been here for 40 some years.
Fantastic. So you started out there as a nurse and became the manager. What's your position right now?
I'm the director of nursing.
Wow. Wow. So when this pandemic started,
I started here when I was 16 as a nursing assistant when I was still in high school.
Holy cow.
And then when I turned 18, I got married and we moved away for a little bit. And so then a few years later, probably about 4 years later, I went to nursing school for my LPN. And then I got a job here on midnight then.
Okay.
And then I ended up becoming the director of the assisted living, which I did for probably 19 years. And then I decided I went to RN school. And then at first this job for the director of nursing was, I just told them I was going to do it until they found somebody. But later on then, when I was doing it, I decided, it's kind of my life where I could have a change. So I went ahead and took it.
And you've been a director for how many years?
It's going to be 2 years, going up on 2 years.
So you were director, you've been there for a while, but you were director for 1 year before the pandemic hit.
Yeah. Mm-hmm.
So when you first heard about it, when was the first inkling you had that you might have a problem?
I mean, I heard about it and I really hadn't heard much about it until probably about December. And then I kind of just thought, oh, it's just like the flu. Just wash your hands. You know, they're overreacting and I just figured that it was the media causing panic.
Right.
I was very, very wrong. So from when it started here, like in, what was it, February, March?
Yep.
We were very, very lucky. We didn't have any positive cases. We didn't have any positive staff members. You know, we listened to the governor every day and listened to, like he was saying, we're in this together, Ohio. And, you know, we just felt all proud in that we were all going to be working together in that. Then it hit us. And it hit us in, we had a few positive staff members in August, maybe a couple residents, which wasn't bad. And I thought, oh, if this is it, then we're okay. You know, it's not that contagious. We only had 2 residents that were positive, and we handled it, and they were fine.
How many do you have there in total? How many staff and how many residents do you have?
Positive?
No, total.
Right now we have over 200 and some staff members. Residents right now we have about 90.
Okay. And back in March or April.
Just on nursing. we have about 40.
Okay, so in March or April, you had over 100, give or take, maybe?
In March or April, we had probably about 120 residents over here.
Okay.
121, 122.
All right, so 2 cases out of 120 is pretty darn good.
Yeah. And like I said, we thought, oh, this isn't going to be so bad, and we heard about these other nursing homes and how bad it was for them, and we thought, well, they just must not be doing the right things, or they must not be doing infection control and that kind of stuff. Then in November, I'm thinking it was the end of October, beginning of November, it hit us. And it was terrible.
Now, when you say hit us, how did you, what was the first sign of something that you realized something was really bad going to happen?
Well, we had started testing our residents because we had staff members that were positive, and the state had said you had to start testing your residents.
Okay.
The residents for a while, were negative, and we just figured if they were negative, everybody was negative, it was good. And then around October, November, I think I got a call one night that there was probably 15 residents positive down our Cascades unit, which is our dementia unit.
Oh my.
And so we knew if it's down in the Cascades and in the dementia unit, we knew it was everywhere down there because the residents, they just go everywhere.
Yeah.
They touch everything. And me and my administrator, we came in that night and we moved everybody that was positive down to our COVID unit.
How many could the COVID you didn't handle? How many did you have it set up for? And was it?
Well, initially we had only had it set up for, there was 2 double rooms and a private room, so it was only going to have like 5 people in it. It's a whole wing, but we kind of cut it in half so that way.
Okay.
So that way we could still use that wing too.
Right.
Well, when the 15 hit, then residents started showing symptoms, and we had some rapid tests that we could do here. Well, it was the whole unit. We had to move that whole unit down to the Cascade, or down to the COVID unit. And those are dementia patients. It made their behaviors worse. They didn't know what's going on.
They don't know where anything's at anymore. Everything's been changed. They don't know where things are at anymore. They get used to where things, especially when they go in the bathroom in the middle of the night.
Oh yeah. And they were so sick. I've never seen anything like this. I have taken care of people with the flu for years. You don't lose 20 plus people in a month time from the flu. We lost 20 from people. I could come in the morning and the person would be okay, and by nighttime they were dead.
Seriously?
It was terrible. You could, after a while, we got to the point where we could look at the person and know they weren't going to make it.
Oh my gosh.
Their families couldn't come in. I remember sitting on a bed, holding a cell phone, crying to this daughter, telling her, I'll stay with your mom, but she's not going to make it. We're not going to leave her alone. She'll be with us. I said, but you cannot come in.
What were the symptoms? They just, when you say they were fine 1 minute and they were passed away the next, what were the symptoms like? I can't even imagine what they were, because I've never seen anybody die before.
I had people eating breakfast in the morning, and then by afternoon, nighttime, they were, their oxygen level was so down that they were becoming unresponsive.
So they couldn't breathe?
Yeah.
Holy cow.
Yeah.
In a day?
In less than 24 hours.
Oh my gosh.
Yeah, and so, like I said, you could kind of tell the ones that weren't going to make it. We started putting IVs in them right away when after they first started coming down there, because we noticed that they were so dehydrated because they weren't drinking and eating and that. So we started putting IVs in. The IVs didn't help either. Once they got it, if they weren't strong enough, they were going to die. We lost a lot. We lost a lot of our residents.
As a director, how'd you keep the morale up of all your staff? I mean, that had to be just devastating to the staff.
I faked it while I was here, and then I went home and cried because I have a lot of guilt thinking that I didn't do enough to make sure that these residents were taken care of.
Have you ever talked to the nursing homes about it? I mean, and asked them when they went through the same thing, they felt the same thing?
What was that?
Have you ever talked to other nursing homes that have gone through this and they felt the same way you guys did?
Mm-hmm. Yeah. I mean, I think we did everything we could have. I think this virus is so contagious, those masks aren't doing anything. These residents, I mean, they were, like I said, it just kept going and going. We got done with the Cascades, our dementia unit, and then it went to a different wing. And it hit most of those people. And then it started on the other wing. We couldn't get any control of it. It was like we were at war and we couldn't see who we were at war with. And so how are you going to win against somebody you can't even see? And then on top of that, this is such a new thing. I mean, I'm a nurse. I know infection control. I know isolation. I know all that kind of stuff. But with this kind of virus, none of that was working. And, Governor DeWine, and that's one thing, I used to be so proud of Ohio. I just loved Ohio. I'm an Ohio girl. And Governor DeWine, I was like, I was so proud of him, the way he was handling it. And Amy Acton, she did a wonderful job. And then DeWine didn't have a backbone anymore. He decided to go with what Trump wanted to do. And I think that helped the spread of all of it. And DeWine says that we're in this together, we'll help you, but we're not, because the Ohio Department of Health will come here and cite us instead of helping us, instead of telling us how to make it better, how to not do something, or how to help not the spread. They cite us and they give us civil penalty money.
Seriously?
It's just ridiculous. And we asked one of we've had surveyors here so much coming in here just telling us that's not right. Your COVID unit's not right. And then we say, well, what can we do? I said, if you can just tell me what to do, I will do it so it's right. And they're like, that's not my problem, that's yours.
Oh my gosh.
So they aren't out to even help us. So honest to God, I swear to God, the Ohio Department of Health is just as much at fault for these deaths as anybody. Instead of trying to cover their own asses and they won't, like, there's no set rules. They say, well, look at the CDC, look at the CMS, look at the CDC, but they won't. They said, well, you got to go by the CDC. And then later they'll say, no, you got to go by the CMS. And they can't decide. And then they just, I don't know. It's just ridiculous. They come in here with a mask on and all their protective gear, and they walk down our halls for a half an hour because they can't be in the building longer than that because they don't want to get sick, while we're staying here night and day taking care of these people.
Wow. When someone comes in and tells you that you're doing something wrong, they have to know what's right.
Yeah, no, that's on opinions. It's on whatever surveyor's opinion.
Wow. And these surveyors came out of,
one day when they were here and they were telling us how we weren't doing anything right, I finally just said, what do you want? I said, we are here day and night taking care of these people. Our people are dying and we're tired. I said, we've been doing this since February, March. I said, what do you people want? And she's just like, well, you have to look in the CMS and the CDC, but the problem is they change. So they change things constantly because they don't know.
No, they don't. And they're trying to hide behind it.
Yeah. But, you know, they don't feel our loss here.
No.
I mean, we've lost family. These people are our family. You know, we cried right alongside these families for our residents. You know, we have people that we see every single day. You know, they didn't get to see their families, but we got to see them. We were their families, and then they just died. And, you know, I don't know. It made me really question about being a nurse. For a while during the really rough part, I thought, I don't know if I'm strong enough to take losing all these people.
Well, here's why I say that you're a great nurse and people benefit from you because you care. The people who are the surveyors don't give a crap, and they're hired because they knew somebody who knew DeWine, so they got hired in a position and said, here, just follow this piece of paper, and if they don't do it, just check this off, and then we'll come back and tell them and fine them. I got a question. You said that they give you citation money.
Oh yeah.
So they give you money that you have to pay as a fine.
Yeah, it's like we had one that was like $10,000.
So they say, okay, you're fined, so we're going to give you money, you must pay us.
No, they don't give us money. We have to pay them that money.
You have to pay them.
Yeah.
Out of the pockets of Good Shepherd.
Yes.
Holy crap.
Yes. That's what's wrong with our, that's why, like I said, I have no respect anymore for our government because they should have known. They should have known. They saw China. They saw what was happening. They should have known. They should have taken it more serious. They should, instead of saying, you know, there's Trump when he had COVID running around without his mask on or whatever, you know, that's ridiculous. It's ridiculous. People died. Lots of people have died. My uncle just died 2 weeks ago from it. And right now he was in the hospital, and because the state has been here and we were out of compliance and they wouldn't let us get into compliance because they kept coming and citing us for stupid crap. They cited us for having cookies uncovered for a picture.
Oh, for crying out loud.
Yeah, because we had a holiday thing, not a party, because, you know, you can't have parties, but we took cookies around, and they cited us for that. So we can't admit Medicare and Medicaid right now because we're not going to get paid for it. So my uncle had to die in the hospital when I wanted him to come here.
Wow.
Because we weren't allowed to let him, we weren't allowed to admit. Yeah, I don't think I'll ever get over this. I mean,
I wouldn't.
The anger that I feel that they just left us hanging.
And then they punish you. They punish you for it.
Every single day. I came in at night. I worked that COVID unit every single day, right alongside my staff. But a surveyor can only come in here 30 minutes and be out the door. And they couldn't go in a room. I put my life at risk every single day for these people, and I would do it again. But those people have a dang pencil and paper, and that's all they do. That irritates me.
I'm irritated right now just thinking about it. I can't even imagine it. I can't even imagine it, that you are risking everything, and your emotions are right there because people are dying all around you. And somebody comes in with a clipboard and says, you messed up because of the cookies, here's $10,000 fine.
Yeah, that's exactly what it is.
Well, it shows. Here's my opinion, and I can't prove this, but my opinion is people in government are really stupid. That's why they're in government. Yeah. But when you have a lot of people together, let me put it this way, and I've been to DC many times with a couple of different things I've pushed through. But when you have a lot of people together that are stupid, they all think they're smart.
Yeah.
because they're all together in the same, we must be smart because we're all in the same business. No, they're stupid. And they don't know how to fix things or how to figure things out because but they're all together and they're all thinking that they're smart. So we'll all be good. And it's obvious if they can't, because they changed everything so much all the time. And I heard that all the time, by the way. They kept changing things all the time. They didn't know what to do. It was worse than a doctor saying, come back in a week. If you're not better, I'll try this and come back in a week. If you're not better, I'll come back in a week. We'll try this. I mean, that's what it was like. Only went on for months and months and months. Well, this is why I'm glad. I want you to know why I'm doing this. Because I want the people to see it and to feel it and to hear it. This is what was happening because a lot of people don't believe it. And you know that when you're out there. They don't believe that it was real. They think it was made up by the government.
Yeah, I mean, yeah, a lot of people, I mean, and I have a lot of friends that are like, oh, they just blew it out of proportion. Really? Because over 20 lives is not blowing out of proportion.
No.
There are 20 lives that were lost because of this. And could it have been stopped? Probably not. But you know, don't make it less because you think it's just a hoax or whatever. These people died. And yeah, they were old, but they died. They didn't probably have to die from that.
When did it stop? When did it slow down? When did you realize that you were coming to the end of it?
What was that?
When did you realize that you were coming to the end of it, that it was slowing down a little bit as far as the death rate's concerned?
Well, I think we finally started to be able to breathe maybe the end of December, maybe beginning of January. I mean, they started slowing down because I'm telling you, when they tested positive, if they made it past day 7, 8, or 9, around there, then we knew they were going to make it. But by that 7th day, you knew if they were going to turn, they were going to die. If they started getting really bad around that time, they were dying.
Wow.
So, I mean, we lost a lot of people in a little bit of time. So, I mean, they got sick, they died. They got sick, they died. So they don't hang around when they have it. They die pretty fast. I think we went through 90-some residents with it. You know, only a handful of our residents didn't get it. And I don't know why they didn't get it, but they didn't get it.
Wow. So everybody got it, essentially, almost everybody.
Yeah, the majority of them did, yeah.
All within a month or two?
Yeah. Yeah.
That's how fast it was.
Yeah, it was never ending moving beds and moving people in, moving people out. As soon as I could move them out of the COVID unit, I was moving more people in.
Wow.
We would come in and move people on a Sunday, and then by Monday we'd have results moving more people in. So we would come in on a Sunday, move them out, clean, get it ready, and know that it was going to be filled back up.
Wow.
The next day. And we were just hoping that it wasn't going to be filled up to the max, because at one point in time it was pretty full. We did what we had to do to take care of our residents.
Did you lose did any staff people quit?
We had a few, and that's fine, because the one thing that this virus has showed me is the people that are here right now are the ones that stuck through it all, and they're the ones that I want to keep.
Yeah.
They're the ones that worked beside me. I mean, I had a nurse that was scared to death to work down there, but she worked down there. She went in the bathroom and cried for a little bit, and then she came out. And she did it every day. They were scared. We were all scared. Everybody has a family at home. We didn't know. We're seeing all these people die, and we don't know what it's going to do to us. I think I can't remember how many how many staff had it, but it was quite a few. I don't know what the number was, maybe 70 some staff members maybe. And then, and then we had to work on that. We had to work on, we had staff. At one point in time, we had 30 staff members out when it was really bad. And it's like, then you had to break people up to work this and work that. I mean, I worked many a midnights as an aide down the COVID unit because we just didn't, all the aides were out. But we've seen, I've seen who's strong and who cares. And, the weak ones, they didn't make it, and that's fine. I mean, it's just not their job, because you don't run out on these people.
No.
If you run out on these people, this isn't the job for you. And I understand people were scared, but you just gotta do it. You gotta take care of people.
Well, it'll be interesting to see a question when you interview new people is you ask them, where were you when COVID hit, and how'd you handle it?
Yeah.
Because this is one of those landmarks in time when it comes to this kind of industry. When you want to get high, I was talking to a New York City nurse, and she's got people waiting for lung transplants. And I realized, I was like, you can't get a lung transplant now because the odds of getting a healthy lung are pretty low.
Oh, yeah. Yeah, and the damage that it causes to your lungs. I mean, we have had residents that have gotten over the actual virus part of it and made it a month or so. But the damage to their lungs was so bad, they were wearing oxygen all the time, that they ended up dying anyway.
Oh, wow.
So we have had a few that lasted a while and then ended up dying. But, the damage to your lungs is just unbelievable. It's not anything like we've ever seen before. And, we finally got caught our break, like residents were negative and staff was negative. I think we went like 2 or 3 weeks with everybody negative, but, Monday we did some tests, and, 2 of our staff members who have had COVID before are now COVID positive again. And they've been negative. So now people are getting reinfected. And so now that's scary. And, I'm like, oh my gosh, I can't do this again. I cannot do this again. I cannot lose 20-some people again. I just can't do it. So I'm going down the halls, barking like a drill sergeant. Keep your mask up, do this, do that. I don't know if it's going to help, but at least I'm saying something. But I guess if it's going to hit, it's going to hit.
Nikole, have you seen or heard from other nursing homes that have had 2 waves come through?
I've heard of nursing homes have 2 waves, but usually it's for people that weren't infected the first time.
Right.
This is the first time. I mean, I've heard people that were able to get reinfected, but this is the first time I've actually seen it. I really didn't know. And these people have the immunizations also, the vaccine also.
Oh my.
Which, people are a little bit, they're not educated very well on that vaccine, because you can still get COVID even though you have the vaccine. You're just not going to have the symptoms.
Right, right.
Some people think that, I had the vaccine, so I don't have to wear a mask anymore. And I've had a lot of that. I've had a lot of people tell me that, and I'm like, oh no, you need to wear your mask. It doesn't matter if I think we'll be wearing these masks for another year and a half, maybe 2.
I think so too.
I don't think it's just going to be a normal thing. So.
My dad, he was born in 23, and he died in December of 19 at 96. But he remembers his mom talking about the Spanish flu back in 1918, and that how many families he lost, members he lost back then. And he wasn't born yet, but he heard his mom talking about it. Because I asked him about that about 20 years ago, because it always intrigued me about this whole Spanish flu in 1918, 1919. And when I first heard about the COVID, I looked it up and watched a couple different YouTube videos on it, and it was amazing. I don't know what we did to stop it. If we had any, we didn't have vaccination, I don't think back then. I don't remember seeing about a vaccination on that. But it's just amazing how it wiped people out. And you saw in the cemeteries, because I come from a small town in the east side of Cleveland, and you could see the cemetery plots with everybody on the same year, from child to adult.
Oh yeah, yeah.
And it has wiped out whole families. And my mom remembers polio. She remembers when polio was hitting the 30s and 40s. And then the vaccine came out, and everybody was just so excited about it because it wasn't the fact you weren't going to get it; it was the fact that it minimizes the symptoms, and that's the whole thing. That's what vaccines do. They don't prevent you from getting it; they just minimize the symptoms of it. But you're right; people don't understand that. And you know what? No one gets vaccinated when you're adults. Think about it. You always get vaccinated when you're kids, and you don't know why you got vaccinated as a kid. You just did it because your mom made you do it.
Yeah.
But so people aren't educated. You're right about the role of a vaccine. What does it do? So people you've all got vaccinated, right? As far as staff there?
No, they had a choice whether or not they wanted to. And I'm not sure how many. I think maybe half of the staff probably got vaccinated. Other ones didn't.
Okay.
It was their choice. It wasn't mandatory, so they didn't have to do it. I took the vaccine and got sick both times. But if that's what COVID felt like, then I'll gladly have gotten sick twice with that, because I felt so sick the day after each vaccine that I can imagine what these residents felt like.
And it happened, as you said, it happened so fast. You're healthy 1 minute, and then you're going on the tubes the next minute. I can't imagine that. I can't even imagine that.
Yeah.
Well,
it was terrible. I mean, like I said, we just held their hands and we loved them until they died. That's all we could do.
Your strength through all this is amazing.
Yeah. Like I said, I would go home and cry and maybe have a few drinks.
Well, it's understandable. Do you think that there's any kind of, I don't know, I'm going to guess at this, but as you mentioned before, that you've been through a war with this thing and you couldn't see the enemy. Do you think that there could be any PTSD on this? Do you think, like, because I talked to vets many times.
Yes, I can definitely. I mean, if our residents start getting sick again, I think we're all going to have a nervous breakdown, because it's just, you don't forget that. You don't forget all those people in those rooms. And like, we would put 2 people in a room that were dying so that way we could sit with both of them. And you don't forget that. I'll never forget that.
I asked a question of Franny on this, but when you were with somebody in the room and they were dying, did you sense anything after they passed, like you could feel their spirit leaving at all or anything?
As a nurse, I've dealt with death a lot. I've never really sensed it, but I always open the window, because that's just something that I don't even know if I don't know who told me to do it, but I did it because that's how their spirit goes out the window. And that's what we do. We open the window so their spirits can go out.
Yeah, I heard that, but I never heard that before. That's brand new to me too.
Mm-hmm. I don't know who told me. I mean, I've done that forever. So, I mean, I don't know. I know that my residents see people when they're dying. I mean, they talk to people that aren't there. They say that there's somebody standing at their bed, and I'm sure there is. I don't sense it, but all I sense is some of them are scared, some of them are peaceful, and we're just sad. So.
Did you ever have any family members?
Sometimes you get so, before all of this, and I'm not saying that I wasn't sensitive to death, because I've always been one to sit with somebody. They shouldn't be dying or whatever. But think this made us better. It made us more sensitive to our residents. It made us more, I guess that showing more love to our residents, showing more emotion. You know, knowing that all of us are human. So I mean, it did give us some of that.
And also to treasure every moment, because you never know if you're going to see them again.
No, yep.
When someone looks at your
it.
art, when someone looks at your artwork in the gallery, what would you want them to come to walk away with? What image would you like them to walk away with? Or what feeling?
I guess I would say it would have to be some anger, because I'm just mad as hell still. But then sadness, and then later hope that, or not even hope, sadness, and then camaraderie, I guess, maybe, you know, with my nurses and with my aides, you know, they were crying, and my aides would be crying in the hallway, and we'd just stand there and hug, you know, we're a team. So I guess it did bring us closer together. It's just sad that it was the sadness that did it.
But your strength is what kept the people together there, as far as your staff's concerned, that's for sure. I mean, I know you said you went home and cried, but the fact that you kept your staff and just a few people left says a lot about you. That's for sure.
Yeah. I mean, we got a pretty good group of people. When I first took this job over, the director of nursing that was here before had ran out most of the staff, and so that's why I had told my executive director that I would do it. I said, you know, I'll do it if you can find somebody. But when I took the job over, aid-wise, we only had a handful of aides. I mean, it's taken us this long to get our staff back up to the level, and then to the level that we need.
Wow.
And thank God, like I said, we've got some pretty good ones. The bad ones kind of weeded themselves out. So.
Well, I'm very glad. My mom is at a nursing home in Chardon, Ohio, which is where I grew up at. And I can only hope, and I like the staff there. I mean, you know, she's doing great. And I'm really proud of her that she's handling through all this stuff. She's 90, but she thinks she's 100. So I'm not going to argue with her, you know? When you have Alzheimer's, you think you're 100, you're 100. I'm fine with that. But I can only hope that they have the staff like you have, because you're a tremendous person. And I appreciate the fact that you have done this for so many people. For so many people, you impacted them in a positive way, whether they were dying or whether they were living. You impacted them in a positive way. And that's something that I hope that you take with you forever, because you lived it. I just felt it in the last 35, 40 minutes, and I'm going to feel it for a while, but you've lived it every day for all that time. It's amazing to me. It's absolutely amazing to me. Wow.
Yeah, like I said, if everybody could just get a glimpse of the devastation of it, I think maybe we could get rid of it faster. But you know, there's always going to be people out there just saying that it's a hoax.
Yeah, I know. That's one reason why I had this idea, because I wanted to convey to people that it's not, and I wanted to find out. I wanted to ask questions. I wanted to hear the stories, because I mean,
unless you're affected by it, they don't understand. But you know, people have lost their moms, their dads, their husbands, their brothers, their friends. You know, I just lost a friend 2 weeks ago. She was 47 years old to it.
Wow.
You know, it's not a joke. Her daughters don't have a mom anymore.
47.
You know, it's not a joke. It's not a joke at all.
Wow. Nikole, thank you. Not just for this recording, but for all the effort and all the pain and all the suffering that you went through for all that time, and you still stayed there. And I know I'm not a staff member, nor am I a resident, but I am so appreciative of the fact that you are there and that you got them through it. Great job.
Thank you.
Great job.
Thank you.
When I get the artwork assigned, now you won't meet the person until the artwork's been completed. And we're going to have the show sometime in May at the Tiffin Art Guild. So I'll keep you details on the way. I'll email you as we go through things, okay?
Okay. All right.
Bless you, Nikole. Thank you so much.
Thank you.
Bye-bye.
Bye.